this is Joe with Grandview Aesthetics. Today I'm here with Cassie and we're going to talk about electrolysis.
Hey guys.
Cassie, what exactly is electrolysis?
So it's the only FDA approved permanent hair removal. So super simple. I take a tiny needle like the size of a hair, insert it into the follicle, and I use radio frequency or galvanic current. So that kills the blood supply. So if I pull the hair out and it's a straight hair, another hair is going to come back in. If I pull the hair out and it's just a bulb, that it's dead. So you don't have to worry about coming, over and over. But with hormones, sometimes you get more hair growth. Just depends on the hair.
So it can be take multiple treatments to have full results?
Yeah, it does. Typically, if it's super thick gray hair, which is usually what I do treat because a laser doesn't pick that up. So I go back over that hair. Usually there's a lot of hormones with that hair. If someone plucks over the years, it's pretty deep in the skin. So I have to go back over that maybe a few times. But a lot of my patients, they'll come in. I do maybe about half an hour sessions like every 2 weeks. And then after a while, eventually they're just like thinner hairs. They kind of change the shape of the hair and in the skin. So usually I can get them pretty much cleared up, and then it's just touch-ups, maybe like 6 months to a year, kind of like with laser hair.
Okay, so is this considered a permanent hair removal as opposed to laser hair reduction that you do?
It is. I mean, it's the only FDA approved, like I said, but with hormones, you can't ever really say you're never gonna have hair again. You might just have, but like I said, if they pull the hair out, it's the full bulb, it's dead. So basically you're electrocuting the hair, like the skin, if that makes sense. So you're kind of just frying it and killing it off. So you might have another hair like right next to that follicle. People come in, they're like, oh my gosh, my hair grew back, but it really does kill that one specific hair. So compared to laser, it's one hair at a time, so it targets it, versus like 30 hairs at a time. So.
And if you're doing a hair at a time, what's the time frame? Say you're under a male underarm, how long would that take to do?
So we could probably do, I get about like 30 hairs out in a time. So it's about 15 minutes for, that time period, because we usually do it per time, like 15-minute sessions. So about 30 hairs, so.
And you said, you mentioned a needle. What is the procedure exactly? Does it hurt? Is it you sticking someone with needles and pulling hair out? What happens?
Yeah, so a tiny needle goes in the follicle, just the size of a hair. So you really don't feel me going into your skin because it slides into the follicle. So I'm not puncturing the skin. You're not going to be, crazy bloody or anything like that. It's more of just sliding in the follicle, apply the current, and then pull it out with tweezers.
And when someone does this procedure, are they able to go right back to work afterwards?
Yeah, definitely. A little bit of pink. Sometimes it's, you're a little bumpy. Just depends on how much I've worked on that hair. Sometimes you're kind of pink and bumpy, but you can do like a mild, like an antiseptic basically. So if you want to do witch hazel, alcohol, just to keep it nice and clean. You can put sunscreen on, like a light powder if you want as well. Like if you're wearing makeup, if you want to just kind of cover it up, but nothing super heavy, nothing scrubby on that skin.
And why would someone do this as opposed to laser hair reduction?
So if they have gray hair, white hair, really light blonde or red hair, laser doesn't really pick that up. So, if you do laser, you notice that you don't really have any changes. Sometimes you'll do laser maybe like 13 sessions or so, which is above the average what we recommend, because if you do 8 to 12, which is for laser, usually you're going to have a lot of reduction. Some patients have really stubborn hormones, so you have to go back over with electrolysis, and it does get rid of it, but it takes some time if you have hormonal imbalance. So.
And with the electrolysis, you said is it like a shock? Do you feel a shock when you get the treatment?
It's more of just a gradual heat. So laser is more of like that zapping feeling. This one's just a gradual heat with the the frequency that you're applying. So radio frequency is usually what I use.
And what do you offer for this product? Underarms, legs? Or?
Yeah, we can do just about any area. The only counterindication is if someone has a pacemaker. Some of the frequencies can kind of, counter in that. You don't want to cause any issues with that, obviously. And then you can do just about everywhere in the body. I mean, pregnancy is another one that we want to, watch out for. You just don't want to cause any issues. So, and then if you're a diabetic, you can cause slower healing process, but you can still get it done. So you can do any part of the body, really.
And how long should one schedule this beforehand? Like, should they call you a week in advance, a couple weeks? They need a consultation beforehand?
Typically consult, that way we can, really look at your skin and your hair. Sometimes you might be a good candidate for laser, sometimes you're definitely just electrolysis. So, a good consultation with Dr. Nanda and even myself, we can talk to you, look at your hair, and then sometimes you can get treated that same day. Sometimes you have to let the hair grow out a couple days, so.
All right, great. This is Joe again with Grandview Aesthetics. You can call us at 614-421-7546 or visit greatskinohio.com to book. Thanks, Cassie.
Thank you.